Hello, good morning, good evening, whenever you're going to be listening to this recording. Today, I am going to be making my presentation with the title Holistic Compassion Addressing Physical, Emotional, and Social Needs of the Homeless. My name is Juliet Ekejuba, and this presentation is for a nurse in science, NUR 550, dated today, April 11, 2026. And so we'll start with a brief introduction. Holistic compassion is a cornerstone of nursing practice. It means caring for the whole person, that is the body, the mind, and the spirit, rather than just focusing only on the disease. This presentation explores how holistic compassion can be applied to individuals experiencing homelessness. It's a population that are facing complex physical, emotional, and social challenges. I'll look at the concept definition, its relevance to this population, the supporting nursing theory, the spiritual perspective, and as well as the practical implication for advanced nursing practice. The conceptual definitions start with the etymology. The word compassion literally means to suffer with. It comes from the Latin word compati, where com means with and party means to suffer. Over centuries, the term has evolved through Old French and Middle English, but the essence remains the same, which is compassion is not passive pity. It's an active, shared human experience. In healthcare, especially when caring for people experiencing homelessness, this meaning reminds us that true compassion involves presence, empathy, and connection, and not just treatment. So, how do we define compassion? Compassion is defined by Merriam-Webster Dictionary as sympathetic consciousness of others' distress together with a desire to alleviate it. So, compassion is not just a feeling, it's an active, intentional response. In practice, compassion means seeing the whole person as responding with patience, wisdom, kindness, and perseverance. For nurses, especially those serving the vulnerable populations like individuals experiencing homelessness, compassion moves beyond empathy. It becomes a shared human experience that honors dignity and helps promote healing. So the specific population for this presentation focuses on individuals that are experiencing homelessness. Homelessness is far more than the absence of housing. It is a complex experience that is shaped by trauma, poverty, and systemic inequities. People experiencing homelessness often live with chronic illnesses, mental health challenges, substance use disorder, and profound social isolation. This population consistently faces high rates of preventable illnesses and premature deaths. This is due to the barriers such as their mistrust for providers, stigma, lack of transportation, and competing survival needs. To truly support this population, nurses must address not only health but also emotional support, social connection, and restoration of dignity. In my PowerPoint, I have mentioned some research work that helps define what homelessness is according to their projects. The literature review for this presentation was conducted using CINAHL, PubMed, PsycInfo, and Leninja's theory databases. So I searched the CINAHL, PubMed, and PsycInfo using terms like holistic care, compassionate care, and homeless population. The search had produced over 15,000 results, but after limiting the search to peer-reviewed studies from the last 6 years, I selected 5 strong articles that I had incorporated in this presentation. So this study offered evidence-based insights on holistic nursing intervention and emphasizes the importance of compassionate whole person engagement and individuals experiencing homelessness. So for this presentation, to ground these concepts in nursing science, I chose the Madeline Leininger's transcultural nursing theory, also known as the cultural care theory. So this theory emphasizes that culturally congruent care, understanding and respecting patients' belief, values, and their lifestyles helps promote meaningful healing. This theory is especially relevant for homeless populations who stand for diverse cultural background and experiences. By applying Leininger's framework, nurses can adapt care to align with everyone's cultural context, fostering trust, dignity, and holistic well-being of people. A biblical worldview sees every person as a unified whole. That's the body, the mind, the spirit, and the community. And the concept of shalom emphasizes that true healing means wholeness and not just physical recovery. Research has shown that spiritual practices can help strengthen resilience and emotional well-being for people that have experienced or are experiencing homelessness. And looking at the FICA spiritual tool, this tool helps nurses identify beliefs, sources of strength, and spiritual distress. Example from the FICA tool is asking the question, is there a spiritual or supportive community you feel connected to? This question would help the nurses identify whether a person experiencing homelessness has sources of belonging, emotional support, or spiritual grounding, that is areas often disrupted by their instability and trauma of homelessness. So it's important to know this. And the FICA tool comes in place here to help nurses identify these things. And then backing it up spiritually, using Isaiah 58 verse 7, this verse calls us to care for the poor and oppressed, reinforcing the moral and spiritual responsibilities to extend compassionate and holistic care to the homeless. So how can the MSN prepared nurse apply the information to their current practices? So the MSN prepared nurses can apply this concept by conducting comprehensive holistic assessments, creating realistic care plans for those without stable housing, using compassionate and inclusive communication, and also coordinating interdisciplinary services to support mental health, addiction treatment, primary care, and community resources access. So, universities can improve patient outcomes by teaching holistic, person centered care. So, this includes integrating training on social determinants, trauma informed practices, and mental health, as well as community resources. And also preparing graduates to deliver compassionate, content sensitive care to individuals that are experiencing homelessness and also the other vulnerable groups. By emphasizing holistic compassion, the programs would prepare students to see the person as a whole, recognizing the impact of housing instability, their food insecurities, their cultural backgrounds, and emotional traumas on health. Future studies should examine how social determinants of health interact with compassionate care, evaluate long term outcomes and continuity of holistic interventions, and also to explore integrated care models that combine medical, mental health, and social services in a coordinated approach. These are a few of the future research that I came up with that needs to be done. And over here you can see that this is my concept map, which was made using Canva. This concept map shows how holistic compassion weaves together emotional, cultural, spiritual, and practical care for individuals experiencing homelessness. So, for each component, from the origins of compassion to the lineage's theory, the FICAL tools, and evidence-based nursing practice, they all connect through the central theme of trust and human connection, emphasizing that compassionate care goes beyond symptoms to honor the whole person within their social and spiritual context. And this will bring us to the conclusion. To conclude, in conclusion, holistic compassion is essential for addressing the complex needs of individuals that are experiencing homelessness. By integrating conceptual clarity, nursing theory, spiritual perspective, and evidence-based practice, nurses can provide care that honors human dignity and also promotes healing across all dimensions of life. This approach not only improves patients' outcome but also strengthens nursing's commitment to justice, equity, and the compassionate services. And that is all for my presentation. Here is a list of my references where I got my informations from. Thank you very much, Dr. Mayer, and bye.